Good afternoon, everybody. Thank you for waiting for a few minutes while we handled a couple of technical issues. Thank you for being here and welcome to our February Wellness webinar. Don't go breaking my heart in honor of an observance of Heart Health Month. We are very excited to have Dr. Kris Bly with us today. She's going to be presenting our topic. And Dr. Bly, I'm going to turn it over to you. Thank you so much for being here.
Good morning. Sorry it took a little time there for the technical difficulties, all on my part, not on hers at all. So I'm an emergency physician. I've recently been lucky enough to get a job with Florida Healthcare Plans in the Orange City and DeLand extra hours care clinics. But I travel to the other ones also. So I might actually see any of you anytime if you come in there. So this is Women's Heart Month. It's actually Heart Healthy Month, but I like to focus a tiny bit on the women just because, you know, I'm a woman. But this is going to cover both men and women in a wholesome. So first of all, I want to start with some amazing heart facts. Your heart beats 100 beats a minute. It's a small muscular organ that's about the size of two fists put together as an adult. And it's an involuntary beat, which means you don't have to think about it, which is, really good because you don't want to have to think about your heart beating all day and making it beat by your brain voluntarily. So it's an involuntary muscle that will beat no matter what happens. It beats about 80 beats a minute, which is 4,800 beats an hour, 115,000 beats just in a day, 42 million beats a year. If you live to be about 80 years old, that is 3.3 billion heartbeats. They're connected by a tube system of large to small and then small to large again. The arteries take the oxygenated blood away from your heart. The venous system brings it back to your heart. So the tubing can be as large as the aorta, which is about 1.6 inches or 3.5 centimeters, and as tiny as a capillary bed, which is about a tenth the size of one of your hairs, which is the size of one blood cell. If you stretch out all the arteries, veins, all the tubules in your system, they will stretch about 600,000 miles long, which will circle the earth more than twice. Now, the amazing thing is about 80% of these tubes are the capillary beds, which are the teeny tiny 1/10 of your hair size. So let's go to the next slide here. Each day, your heart pumps over 1,800 gallons of blood, which would be about 1 million barrels in your lifetime, which would be the equivalent of running your kitchen sink on high for about 45 years. It carries oxygen-rich blood and nutrients to your body and then takes carbon dioxide, which is molecular waste, and deoxygenated blood back to your kidneys, liver, and lungs to drop off the waste and get new oxygen to start the other trip around. Now, a blood cell can travel from your heart all the way through your body back to your heart again in about 45 seconds. So it's important to keep these tube systems open and as healthy as possible so that the heart can pump efficiently to move those blood and products around your body. And the key is to keep the tubes open and optimize the heart muscle as much as possible. So male death rate, all ages, all races, and this is in North America, 24% heart disease and 4% stroke, so 28% total heart disease and stroke. Now, stroke is pretty much the same entity as heart disease, but instead of the clot going to your heart, it goes to your brain. So I included those two together just to show that it's a higher number than just heart disease itself. 22% cancer, and then the number third is 7% unintentional injuries, no snickering women, and 5% chronic lung diseases like emphysema, COPD, and others. Men, we are strong. We are men. We also, because we are strong, we have lots of stress in our life, trying to be strong. A1, I've got to bring in the bacon, which leads to, anger, which leads to heart disease. It's one big circle. Not to say all men are angry by any means. So, cause of death in women. If you notice, it's fairly close to men as far as the heart disease. 22% heart plus the 6% stroke brings it up to 27%, whereas 28% in men. And then 20% cancer, and then 6% evenly lung disease, stroke, and Alzheimer's. So heart disease is quite important to try to minimize as much as possible. We are women, we are strong, we are nurturing, we are stubborn. So we are nurturers to others. We are not nurturing to ourselves. We are less likely to eat right, seek help for chest pain, follow up with cardiac rehab. They say men are from Mars and women are from Venus. Well, as our bodies go, that is really, really true. So men's vessels tend to get plaque in the big vessels, the aorta and the large vessels coming out of the heart. Women tend to lay down plaque in their tiny vessels, the little tiny capillaries, where men will get predominantly chest pressure during their heart attacks or blockage problems with the heart. Women will tend to get some chest pressure, but also the side associated symptoms, nausea and vomiting, sweats, pain in jaw, throat, neck, back, and abdomen, rather than the chest pressure. Women typically will show up in the emergency department with non-typical heart symptoms. Now, whereas men heart attack typically is due to a blockage in the heart, women also can get secondary major problems that will mimic a heart attack. But when you do your basic heart testing for heart attack, it will be negative, like a coronary spasm, whereas the blood vessel to the heart doesn't have a blockage blocking it. It actually, the artery itself squeezes down, cutting off the blood flow. Much more common in women. Aortic dissection, where you get a small tear in the side of the vessel, causes chest pain. Much more common in women in your chest. There is a Takotsubo cardiomyopathy, or the broken heart syndrome, where your heart enlarges with inflammation due to emotional stressors. And it squeezes down the vessels and it mimics a heart attack. Much more common in women. However, men can get it too, more so in elderly men. For men, when you test for heart problems, the typical treatments and testing work quite well. But for women, they are starting to look at the idea that women are actually made differently, and that they need to keep in mind the other problems that women can show that will mimic a heart attack. Now, hormones, they get you coming and going. So an early sign for men to have heart disease is erectile dysfunction. So we're going to talk about this briefly, but it's quite important. Okay. Erectile dysfunction is not getting an erection. It is inability to maintain a decent erection. So Mr. Johnson is a very vascular organ, just like the heart is, but it's on a tiny scale. And the damage shows up there first because it mimics the heart as a muscular organ. So if you have blockages in your system, you're going to have blockages in that organ also, which will give you less blood flow and less ability to maintain an erection. Men who have ED in their 40s have an 80% chance of developing some sort of heart disease within the next 10 years, which is really pretty impressive, an 80% chance. Now, older men, when your testosterone drops, men go through menopause just like women do. You just don't see it outwardly so much. But your testosterone drops when you're in your 40s, just like women does, 40s, 50s. And older men will have lower testosterone, which testosterone is a hormone in your system that helps keep strong muscles, which is why men are much more muscular than women. And when you work out, if you put a very strong woman and a very strong man next to each other, his muscles, even though she is working quite hard, his muscles are noticeably more defined and larger due to testosterone. So drop in testosterone leads to decreased muscle mass, abdominal obesity, and can cause something called metabolic syndrome, which increases your blood sugar, increases your cholesterol, and increases your chance for heart disease, diabetes, hypertension, heart arrhythmias, all sorts of good stuff that you just don't want. Women, less likely to seek help for chest pain. So estrogen is a very good hormone in our system. Estrogen increases the blood flow. It lowers your sticky cholesterol. It increases your ability to be able to sleep well. And when you drop that estrogen, then you have problems with heart disease. Postmenopausal women will tend to hold their body fat tends to move around. If you're postmenopausal, you'll know that. Kind of ends up in your stomach instead of wherever it was before, which increases your risk of heart problems. So there's other things that we need to do to keep healthy. If when you are before menopause, you've had endometriosis or preeclampsia or gestational diabetes, you have a moderate increased risk of developing future heart disease because of the estrogen problems, of the lack of estrogen problems. So the hormones, they get you coming and going. So the estrogen regulates fats, cholesterols, inflammatory markers, and clotting. It opens up your blood vessels, so you have nice flow. When you hit menopause, you go from that pear shape to more the apple body style, which increases your cholesterol and increases your blood pressure and inflammation in your vessels. If you have a heart attack before menopause, it's usually not due to heart disease itself, but more from smoking, with the exception of people with a very, very large predilection family history. Mom and dad, grandparents, heart disease and high blood pressure does tend to have a nice genetic component to it, unfortunately. I think we went over that. So what you want to do is be good to self. You are a precious soul. So let's see how we keep our blood vessels open here. Actually, some easy peasy changes, and I'm sure you've heard these all your life. Eat healthier, move more, sleep better, watch blood pressure, don't smoke, and try to maintain a healthy weight. Sounds very, very easy. Could be very, very easy. When you break it down in tiny bits, it is actually quite easy. So I want to talk briefly about inflammation. So your blood vessels should be open tubes, like a PVC pipe, if I may. So when you push the blood through these tubes, it's nice and open, it squeezes through easy. The blood is not just liquid like water, okay? It's made of water, but also red blood cells that carry the oxygen, white blood cells, which are immune cells, which have multiple different jobs, and there's multiple different cells in your immune system. Platelets are the sticky that when you cut yourself, they're the first cell that rushes to that area to help bind up the cut so that you don't bleed every time you cut yourself. Proteins, hormones, sugars, and fats, all that floating around in your blood, okay? So if you have an inflammatory spot, the inflammation roughs up the side of the vessel, like taking a piece of sandpaper and just roughing the side of a tube. And the platelets are very sticky. So as they come by that nice smooth tube and they hit that rough area, it sticks to it. So now you have not this nice open tube, but a tube with a little blob of sticky stuff. So what happens when all these other cells go rushing by, they stick to the sticky stuff. And then now you have a little plaque. So now this plaque narrows the tube. So your heart, the big muscle, has to squeeze harder to try to push the blood through the smaller tubes. This increases your blood pressure, increases the chance of heart disease, fatty liver, cancer, and diabetes. So trying to keep these tubes open and non-inflamed is the goal. So decreasing inflammation, okay? Now, inflammatory foods are exactly what you think they might are. They're the quick stuff. Refined carbs, fried foods, sugar, white sugars in particular, processed meats. So your anti-inflammatory foods would be the opposite. Green leafy vegetables like spinach, kale, olive oil, tomatoes and peppers. You want your brightly colored vegetables and your dark color fruits like cherries and blueberries, very high in antioxidants. Your fatty fish with your increased omega oils, which is salmon and mackerel, tuna, sardines, and those anchovies, which I personally love on a pizza. Green tea, red wine, caffeine in moderation. Red wine actually anywhere from 6 to 12 ounces a day, whether you're male or female. Avocado, olives, nuts, these have your good fats in them, not your bad fats. So the good fats actually, we'll touch on that a little bit later, but their good fats are very heart healthy for you. They open up the vessels, they dump out your extra cholesterol. This diet is called the Mediterranean diet. It increases your natural antioxidants and what's called polyphenols, which are protective compounds in plants that help keep the inflammation low in your body system. If you can actually look online, find tons of stuff on Mediterranean diets, including very, very good cookbooks and such. If you want to partially follow the Mediterranean diet, just eat more fresh, less processed foods, what they call a clean diet now, what mom and dad would call it, a diet 50 years ago. You decrease your white, which would be your rice, your sugar, your flour, increase your whole grains, which is your brown rice, whole grain, breads and noodles. Now, the other diet that helps markedly for blood pressure is the DASH diet, dietary approach to stop hypertension. It's basically a low sugar, low salt, and low saturated fats with high potassium, calcium, and magnesium. It lowers your blood pressure in as little as 2 weeks. Oh, I'm sorry, I did that. That one's backwards. Little than 2 weeks, not greater than 2 weeks. And it lowers your cholesterol levels fairly markedly, specifically the bad cholesterol. It's a flexible and balanced eating plan, rich in vegetables and fruits with whole grains, fat-free or low-fat dairy, and fish, poultry, beans, and nuts. Instead of your, it's about 2,000 calories a day. You replace most or all your salt with spices that your palate will change and adjust to. And the low salt, as goes salt, so does water. So if you have high salt in your system, you're going to retain water, which is why when you're on a diuretic, which is a water medicine that makes you urinate out the water in your system, you're prone for low salt levels because as goes water, so does salt. So increased salt causes fluid retention, mild headaches. You crave salt. You have salt, you crave it. You have salt, you crave it. It's a big circle. Makes you thirsty. You tend to urinate a lot because you have this extra fluid and salt in your system, so your body's trying to get rid of it. So increased fluid in your system increases your blood pressure because now your heart is squeezing harder to try to push this extra fluid through the tubes. So increased blood pressure increases the risk of heart disease, and I think you're going to hear that several times throughout this talk. So this is a very, very simple, easy diet, low salt, low fat. Now, not all fats are equal. There are good fats and there are bad fats, okay? There's 3 different types of main fats. There's poly and monounsaturated, which is your oily fish, sunflower, corn oils, and some nuts, peanut butter, some vegetables, veggie oils and that are liquid. If they're solid, they're not poly or monounsaturated. Saturated, these are the bad ones, okay? It increases the LDL in your system, increases cholesterol buildup. These are mostly from animal products, most beef in particular, palm and coconut oil, fried foods, margarine, processed foods. Now, the really, really bad fats are the trans fats. And actually, I was going through the marketplace the other day and looking at various packages. And with the huge push that we have had through the media, trans fats have actually gone down markedly in the foods that you would normally see them in, which would be your processed foods. And there's signs on all the packages. Oh, no trans fat, no trans fat. So what happens? A trans fat, they take a regular fat and the lab will hydrogenate it, meaning that it shoves an extra hydrogen into their chemical bond so that it will help keep the foods fresh. So this will be in foods that you find that are already made. They're already processed, not what you make at home, but stuff that's already processed. Fried foods, margarine, cakes, pies, pastries, the good yummy stuff that grabs your butt and holds on forever. Now, LDL is the bad cholesterol. It builds up on the artery walls, causes atherosclerosis. It's also a high calorie, fats are 9 calories, carbohydrates are only 4 calories. So when you eat a fat, it gives you more calories in the first place, which if you don't burn it, it has to go somewhere. Your body just stores it as fat. And again, if you have buildup on the arterial walls, you have a decreased tube size. So your heart's beating harder, increases your blood pressure, increases your heart size, makes you prone for heart disease, heart attacks, all that good stuff. Now, HDL, this is your healthy heart. What this does is it absorbs cholesterol and takes it back to liver so that your liver can break it down. Now, let me explain about cholesterol. We hear a lot of, you need low cholesterol. Cholesterol itself is a very good fat in your system. It coats all your nerves and makes them work better. So your nerve, if it was not coated with what's called myelin, would not be able to transmit any electrical activity, which means that none of your body would work because your muscles move because your brain says, I want my right arm to pick up. And it sends a message from that brain down your back, out the nerve to your arm, and then the muscles in your arm squeeze to pick up your arm. None of that would happen without the covering of the nerve. Now, the covering of the nerve is made about 40% of cholesterol. So cholesterol is actually a very good thing for your nerves. It forms cell membranes. It is in bile to help break down food. It helps make hormones, and it's needed to produce vitamin D for you to be able to absorb vitamin D in your system. However, the liver makes all the cholesterol you need by the food you eat. So you do not need to eat any extra cholesterol. Your liver makes all the cholesterol you need. So if you're eating extra cholesterol, where do you think that goes? Your body has to digest it, and it stores it in your body as fat. So having HDL, which is your healthy fat, breaks down the extra cholesterol in your bloodstream before it can be absorbed. And if you're on the low cholesterol, low fat diets, or eating the diet with the good fat, not the bad fat, then you don't need to worry about the extra cholesterol in your system. Good fats help you stay warm, have energy. They make your hormones work. They absorb vitamin A, D, and E. They're essential fatty acids, which you hear about your omegas 3s and 6 that are in salmon and other fatty fishes. Your body cannot make them, so you have to get them through your diet. But these are very, very heart protective, and they increase your HDL. So let me see here. Oh, I apologize. So on the bottom right corner, you can see your normal arteries nice and open. And then you can tell here on the right picture, a narrowed artery you can see how it's not just a evenly closed tube. It actually varies back and forth with the fat deposits on the walls. That's bad. So move more. This is the easy one of all the things I'm going to talk about. It takes only about 2.5 hours a week, which is 30 minutes a day for 5 days. And then also, if you muscle strengthen 2 times a week, that will help too. Now, you don't have to do this all at once. So if you're 30 minutes a day, the studies, they initially thought that you had to have the 30 minutes all at once. If you go for a walk, it has to be a 30-minute walk. But they've done multiple studies and showed that if you walk the same consistency at 3 10-minute times, that is the equivalent of a 30-minute walk. Now, not lollygagging, picking up flowers and stuff, but if you walk the same as you would for a half an hour walk 3 separate times, but any little bit is help. Park at the back end of your parking lot. You get a lunch break for half an hour, grab your food for 10 minutes or get snacky stuff you can take with you, walk around your building, walk around the block, dance while you're standing at home cooking. There's lots of stuff you can do just to move. A body in motion stays in motion. Now, if you are walking, what happens when you exercise, any sort of exercise? Your muscles will increase to perform whatever act you're doing. When the muscle increases, it needs more blood flow because it needs more oxygen, it needs more sugar, and it needs to get rid of the waste that the muscle is using, like lactic acid, to make your body move. Increased muscles increases blood flow. So now your blood vessel tubes become much larger to try to bring these extra nutrients and take away the bad stuff. So blood tubing getting larger, heart doesn't have to squeeze as hard, lowers your blood pressure. Also, you're burning calories, which decreases weight. So if you're having decreased weight, decreased body fat, now your body fat is being used as food. Decreased weight decreases your blood pressure because you have less fat for the heart to pump blood through. So you've got larger vessels, less mass, decreases your blood pressure, decreases your chance of heart disease. And the extra bonus of what's called weight-bearing exercises, which means that it's a bicycling is an excellent exercise, but it's not a weight-bearing. Weight-bearing is something where your feet are actually on the ground. Your body will automatically put calcium in the bones that are stressed. Now, walking isn't so much a stressful activity. However, your body sees it as it because you're moving your joints, you're putting all your weight on your feet, so it will lay calcium down in your bones. Women start developing osteoporosis. By the time you're 40, you've already lost 20% of your bone density. So it decreases your risk of osteoporosis just by walking. Excellent thing. So there's our exercise. Move. It's the little things. Okay, better sleep. Poor sleep. I think we can all look at this and say, oh my gosh, I don't get good sleep. Poor sleep causes poor concentration. Cannot think. And that's worse if you're postmenopausal, and I'll discuss that just in a minute. Your brain during the day processes everything that's happened. And then when you sleep, it puts that in your memory. It helps you plan for the future. It sorts everything while you sleep. So if you're not sleeping well, less than 7 or 8 hours a night, then you're not getting your brain enough time to train itself to do what it's supposed to do to help you be at your optimal the next day. Okay? So it develops, you can become moody, irrational, and emotional, which increases risk of anxiety and depression. It weakens your immune system because your body is not able to reset and fight off the germs as well. You get increased accidents due to poor concentration, decreased reflexes. Increased stress leads to increased blood pressure because now your heart has to beat a little faster to try to pump the poorly oxygenated nutrients because everything's tired. The body doesn't reset and refix itself. It affects insulin release so that it can lead to diabetes or risk of diabetes in particular. So sleep is very, very important. First, regular bedtime, stick to it. You only need to train your brain. So you have to trick your brain into bedtime. So you need a bedtime routine. What do you do every night? Do it the very same thing every night. Go brush your teeth, take your medicine, wash your face, do your ablutions, as my dad used to call them. When you go in your bedroom, lights off, noise off, or white noise for those people that, are weird like that. I can't do white noise. I can't do the lights either. The number one cause, most common reasons for not sleeping well are pets on the bed and spouse snoring. The room quiet, dark, gives you comfortable temperature or just slightly cool so you can snuggle in your covers. Avoid eating within 2 hours of going to bed because now your body has to digest that food. It's not resting, it's working. So when you're working, your brain stays awake because it says, hey, we've got a job to do. We have to do this. Caffeine is not a bad thing, but in moderation. It only takes one extra dose of caffeine today for your body to crave it tomorrow. It's one of the most addictive substances, as I think we all know, with the huge caffeine coffee explosion in the past 10 years. It decreases your sex drive. You're just too tired. It increases your heart disease due to increased inflammation, partly from the higher blood pressure because you're not able to reset and fix yourself. Caffeine is an artificial stimulant. It increases headaches, anxiety. It is a diuretic, so it will make you urinate. It can increase your thirst, increase your heart rate, which would increase your blood pressure. And if you're prone for heart palpitations, caffeine makes that markedly worse. It makes the heart irritable, so it makes it more likely to have premature atrial and ventricular beats, which are from the top and bottom side of your heart, or atrial fibrillation. It won't cause it, but it does increase it if you have it. Okay. And it takes 3 to 6 hours for caffeine to leave the body. So if you're terribly susceptible, then 2 hours is not even long enough. Maybe you shouldn't have it after lunch. A lot of the proponents talk about. Alcohol is a sedative, but it interferes with your sleep. So you fall asleep easier, but then you wake overnight and then you have a poor sleep cycle, increased risk of nightmares due to slower brain activity. And this is a hard one, especially in this electronic age. No electronics in the bedroom. And what they're talking about is actually have the electronics on. So if you have one of those people that falls asleep to the television, your brain sees that and says, oh, it's time to wake up. I need to listen to the show. I need to move. I need to work. The light from anything, you're better to have a light behind you shining on an old-fashioned paper book than you are to read a Kindle before you go to bed, because the light hitting your retinas tells your brain it's time to wake up. And what you're trying to do is tell your brain, oh, no, we need to go to sleep. So if you're an avid reader, bring out the old-fashioned books. Put the light behind you so it's not shining on your eyes. So that way you read for your half hour and then you fall asleep. If you do need to take a nap during the day, a short nap is better, 30 to 45 minutes. Or that next night, it's a big circle, you won't be able to sleep again. So better sleep, best you can. If you can't do all of these, try to do 1 or 2 of these so you're at least getting 6 or 7 hours of sleep. But 7 or 8 is optimal for the vast majority of people. Smoking, I'm sorry for you tobacco users. It's all bad. I looked and looked and looked, and I cannot find absolutely anything good about smoking. It's never good, including vaping, pipe smoking, chewing tobacco, hookahs. Fun to say, not fun to do. Changes your blood chemistry due to the addiction, increases your plaque formations, which again, plaque formation, increased heart disease, hypertension, heart attack, stroke, coronary artery disease. One puff on a cigarette will squeeze your blood pressure. One puff on the cigarette will squeeze your blood vessels down about 20 minutes. So you get decreased blood flow to the smaller vessels, which would be your poor healing for cuts, especially on your arms, specifically on your legs and feet. So diabetics who already have poor blood flow, if you're smokers on top of it, you have diabetic foot ulcers. It's one big circle. Leads to greater than 12 types of cancer: kidney, stomach, lung, mouth, liver, bladder, colon, throat, blood cancers, esophageal cancers. There are more chemicals in vapes than we currently know of. Right now, they know they've counted over 7,000 chemical additives to cigarettes. They've counted over 4,000 in vapes already. And greater than 250 of these are toxic. Arsenic, ammonia, formaldehyde, heavy metals, carcinogens, weed killer, because that's what you want to be sucking in your lungs is a little weed killer, right? 1 hour of hookah is equivalent of 100 cigarettes. So it's just bad. That's just what you're inhaling. Increases your anxiety, increases your heart rate, squeezes down your blood vessels, damage to the small air sacs called alveoli in your lung. So the heart pumps harder to move around the poorly oxygenated blood. You have decreased ability to exercise, not enough air because you can't get the oxygen to your muscles, which again increases your blood pressure, increases risk of aneurysm, decreased blood flow, decreased healing from cuts. You also, for women, increased risk of infertility, pregnancy in your tubes instead of your uterus, placenta problems, premature births, low birth weight babies, increased risk of miscarriages and abortions, cleft lip, and other defects. Premature skin aging, specifically from the you get decreased blood flow to the capillaries. So your skin looks old because the furthest away from your heart is your skin, to be honest with you. So just don't do it. Sorry. There's multiple ways to quit smoking. You can quit smoking with patches, with fake cigarettes, with chewing nicotine, with help all over the place. Online, there's Tobacco Free Florida. There's betobaccofree.gov. FHCP has multiple stop smoking problems. If you just talk with your doctor or look online at the FHCP website, you can find lots and lots of free resources. And the studies show if you want to quit, anything will work because you have set your mind that I want to quit. So when you are ready to quit, anything works, which is an excellent knowledge to go into that, knowing that when I'm ready, it's going to work for me because I'm ready. Okay, next step, maintaining a healthy weight. This ties also into the diets we were doing earlier, so I won't touch on this too much. Increased weight increases heart disease, hypertension, coronary artery aneurysm, which is where the vessel actually gets large and balloons out on the side, increases cholesterol, increases the chance of diabetes. Are we seeing a pattern with all these problems? Decreased movements, poor eating habits, increases your inflammation. So healthy diet lowers inflammation, also creates a better mood, more endorphins. It ends up being a big circle back to you so that you eat better. You go for a walk, you come home, you're not going to want to eat a big fatty dinner with lots of pastries and stuff. But you feel good from the walk. You get the endorphins in your brain that tell you, I feel great. So you're going to eat healthier. And now that you're eating healthier, you're like, wow, I feel better. I think I'll go for a walk. Again, the big circle. Know your blood pressure. This is, thanks, Mom and Dad. Genetics are very, very important here. And unfortunately, you can't undo your genetics, but you can make your gene pool as positive as possible with the other heart healthy changes that you do in your life. So your systolic blood pressure is an upper over lower number. The systolic, which is the upper number, measures the force of blood coming out from the heart. The diastolic, which is the lower number, measures the pressure when the heart relaxes and fills with blood. So you got your pushing and your relaxing. The new standard below 55 is 120 over 80. The goal is to be that or under. The above 55 is 130 over 80. The artery walls are, for higher blood pressure, the artery walls will thicken and get less pliable. Now, there's things you can do for higher blood pressure, medication-wise and non-medication-wise. Once you go on blood pressure medicine, antihypertensives, typically once you're on them, you're always on them. So unfortunately, that's just what happens. Once you have that disease, you can lose weight and be as optimal in your system as you want. But it's important to keep your blood pressure low with the medications so that your body will go on to work optimally. They have done some studies with these numbers. If you are above 70, it's better to keep your top number, the systolic blood pressure, in a 120 to 140 range, because 120 and below, elderly people get lightheaded, dizzy, and then it increases their risk of falls. So it's actually more healthy for an elderly person to be in the 120 to 140 range so that they don't, God forbid, fall, break a hip, break a shoulder, hit their head. But over 140 is still considered high and increases your risk for other problems. And as I tell my patients who don't want to take their blood pressure medicines, pull up your big girl panties and take your meds. Everybody has something they end up taking a pill for. Take your medicine and move on with your life. It is what it is. Do the best you can with your diet and your exercise and your sleeping habits and choices, and move on and have a happy life. This is the American Heart Association's blood pressure management. If your blood pressure is above 180 at the top number, you do need to see a doctor. If the blood pressure bottom number is greater than 120, I would actually say I'm an emergency physician. I would say if it's over 100, you should see your doctor, not 120. I would bring that down some. The last but not least, this is the easy peasy thing and the hardest one to do. Be happy. The happier you are, it decreases your stress, which will decrease your hunger and increase your energy. Increased stress increases your cortisol levels, which is a natural occurring steroid in your system, like prednisone. So you store more fat, your body doesn't listen to the insulin, and you become insulin resistant, which leads to diabetes. Diabetes breaks down your microcapillaries, which are the tiny little blood vessels, which increases your blood pressure, increases your fluid intake, as we've discussed, decreased healing, kidney problems, eye problems, stroke, Alzheimer's. Be happy, meditate, do yoga, sit and have friends over twice a week and laugh and talk and have your 8 ounces of wine together. Sex, chocolate, friends, laughing, they all decrease heart disease. It increases the good feeling chemicals in your brain, which decrease the heart rate, decreases the blood pressure, relaxes your body, decreases inflammation, increases your face value. Be happy. Anything you can do to keep yourself happy would be a positive step. And there we have it, the 7 easy ways to lower your risk of heart disease.
Dr. Bly, this has been great. Thank you so much. We do have some questions.
Okay.
Okay, here we go. How do you differentiate between broken heart syndrome and a MI, myocardial infarction?
So broken heart syndrome, you have the heart actually enlarges with the inflammatory response. So when they check your blood troponin levels, which is an enzyme that your heart kicks out when it's damaged, they won't elevate. And when they do a cardiac catheterization, where they put the little tube up your artery and blow dye into the vessels, your vessels are open. So all your markers, all your test markers for the heart attack are negative. However, when they do an ultrasound, which is called the echocardiogram, your heart is enlarged appearing, and it can give you small, if it's a large enlargement, you can actually get valvular problems that they can see. And as you, so that's the main thing. Those are the main. It's the test results are not positive like they should be for a normal blockage heart attack.
Okay, that was good. Good explanation.
We don't have tests yet for heart inflammation. Now there is an inflammatory. Congestive heart failure is also inflammation of the heart, where the heart stretches to try to keep up with the extra fluid in your system. And the studies are looking at markers equivocable to congestive heart failure blood tests to see if they will also show the broken heart syndrome, but it's not there yet. You have to have a really smart doctor.
If blood pressure fluctuates high in the morning and low in the evening, how much fluctuation is too much?
As long as it does not cause symptoms, your blood pressure can fluctuate all it wants. Your blood pressure basically does what you need it to do. So when you're laying, your blood pressure is lower. When you sit and stand, your blood pressure will initially be higher and then should steady out. As long as you're not symptomatic, meaning you're not lightheaded, dizzy, you don't have chest pressure, you're not short of breath, you don't get sweaty, you don't feel palpitations, then it can fluctuate. And it should fluctuate as you move, as you rest, as long as you are under the normal markers. So if your blood pressure is under 130/80 and you don't get dizzy and you don't get palpitations and sweaty, and it varies back and forth from 100 to 120, you're fine with that. Symptoms are the main. One, you look at the blood pressure number, and two, you look at your symptoms. If your blood pressure numbers are under the normal number, now typically under a 90 or lower top number, systolic number, is too low. People typically get dizzy, lightheaded when it's 90 because the blood has to pump up to your brain and down to your organs from your heart. So if it's too low, it pumps down, but it doesn't pump up well. You have to have enough pressure to pump up to your brain. So if you're getting dizzy, lightheaded, that's too low of a blood pressure.
Okay. Somebody wanted to know if cold hands and feet are indicative of a blood pressure issue.
They can be more indicative of a vascular issue. If you have decreased blood flow to your periphery, to your hands and your feet, to the tiny little vessels, it can make them cold. There are several disease processes. There's one called Raynaud's phenomenon, which is it's treatable by going to a warm climate. Or your hands in the winter, when it gets cold, they get cold and white with blue fingertips. It's a vascular problem, but it's not a bad vascular problem. It makes your hands feel bad, but it doesn't injure you by any means. But there are several vascular problems that can injure you. So if you have cold hands and feet, you need to see a doctor and probably see a cardiologist for some testing to make sure that your vessels are open all the way down to your hands and your feet.
So this is, are you familiar with the VERTA program, Dr. Bly?
I am not.
Okay. So there was asking an opinion about VERTA, but if you're not familiar with it, we don't have time.
The VERTA, I'm sorry, I thought you said, the VERTA program is an awesome program that our FHCP subscribes to.
Provides. Provides.
It's basically a ketotic diet that not only helps you lose weight, lower your cholesterol, increase your blood flow, optimize your body system. For overweight people, 40% or with 40 or more, with your BMI of 40 or more.
Right. So the question is, let me interrupt you. I'm sorry. But the question is, because it is a higher fat intake, and this person says it appears to be a higher sodium fat intake, is that counterindicated for
actually
hypertension?
Actually, your blood pressure or your blood cholesterol lowers fairly markedly on a ketotic diet. And unfortunately, I can't tell you the specifics why. I don't know that offhand. But it does go down quite markedly.
Okay. Good to know.
And it goes down quite markedly.
Okay. So I'm going to,
whoever asked that question, if you either call Diverta people, or actually if you look online under ketotic diet, lowering blood cholesterol, it will give you reams of information, but it does. Now, ketotic diet is not for everyone. However, it has been proven to be very good for weight loss, very good for high cholesterol, and some diabetics do very well on a ketotic program.
Dr. Bly, are brief spikes of extreme blood pressure over 180 systolic from lifting weight, panic attacks, being surprised, etc., dangerous?
No, not if your body brings it back to normal fairly quickly. And again, are you symptomatic with them? So if it happens and you develop symptoms, then you should just have it checked by a cardiologist to make sure. But typically, no, those are normal responses to your fight or flight symptom. Your heart rate goes up, blood pressure goes up, makes you ready to pounce. And then it should come back down to normal.
Okay. And should a woman try to get hormone replacement after menopause? It's not easy. The comment is it's not easy to lose weight after 60.
Oh, exactly. If you're going to do hormone replacement therapy, you need to start it while you're going through menopause. Once your estrogen stops, after so much time goes by, it actually is not good to start estrogen again. It increases your risk of certain cancers. But if you are going through menopause and you continue the estrogen with hormone replacement therapy, is actually still quite heart protective. Now, I'll be brief because I know it's time. There was a question years ago. They were using very high doses of hormone for hormone replacement therapy. What they do now, and then they're finding women were getting, female cancers in their ovaries, tubes, breast. Now they use a very low dose of hormone replacement. So it covers your symptoms as well as with the hot flashes, the dry vagina, urinating all the time, poor skin tone. So they use a low dose so that it gives you the good of the estrogen without the bad of the postmenopausal estrogen.
Okay.
Yeah, it's a good thing.
Okay. Somebody asked the question about foods that lower blood pressure, and you did spend a lot of time talking about that. So I will, and if you signed in late to the meeting, I will invite you back to the 4:00 presentation, or we are making this whole presentation available on our FHCP YouTube channel. It'll be ready in a couple weeks, and we will send out a notification that the presentation is ready, and you'll be able to view it again when you have time. So again,
for whoever asked that question, look online at the DASH diet or Mediterranean diet.
DASH or the Mediterranean.
It'll give you a huge list of the foods.
Mm-hmm. Anything else? Again, thank you all so much for hanging in there with us. We really appreciate it. We're sorry we had a late start, and thank you for hanging in there through the end. Thank you, Dr. Bly, so much. It was a great webinar. You're getting lots of thank yous. I don't know if you saw the chat or not. And thank you so much. We'll see you guys in March. We are doing the Mediterranean diet on March 17th. So we look forward to having you then. Bye, everybody.
Bye. Thank you.